Morgan A. Leon Herrero, Governor of Guam, Nagahagan Guahan, and Linda Pico DeNorsi, Director of Public Health and Social Services, as well as Rear Admiral John Manoni, Commander, Joint Region Marianas. And now to Governor of Guam for her opening remarks.
Thank you, Janella. Half a day. Tomorrow, I will participate in a weekly conference call with Vice President Pence and the governors from every state and territory in the nation. The focus of this call will be the recommended guidelines for phase one of reopening America again. Based on what we know now, the nation's experts believe lifting community restrictions should be based on two immediate criteria. One, 14 days of consistent decline in the number of new COVID positive cases. And two, adequate hospital capacity to meet a new surge if it comes. The White House has made clear that only local experts on the ground should determine whether or not these criteria are met. I am told that the second focus of this call will be an update on the nation's testing capacity under newly executed provisions of the Defense Production Act and how this increased capacity will be distributed. As has been said nationally, reopening Guam won't be like flipping a light switch. It will be like watching the sunrise. It will be slower than any of us want. It will be measured and made very carefully. In preparation for this expanded testing capacity, I have asked Public Health and our Physicians Advisory Group to expand our priority testing categories. I know that many of you have wondered why the number of executed tests has declined in the past few days. This is simple. Fewer and fewer people present themselves with COVID-19 symptoms at our hospital and clinics. This is a good sign, but it does not mean our war is won. Many COVID positives have mild or no symptoms at all. That is why testing we can rely on is needed. We must also prepare the way forward. Our community is worried about what this pandemic means for their health and the health of their loved ones. But they are also worried about the day after, about their jobs or their businesses, their savings and their bills. They know the difficult decisions we have had to make to keep the island healthy and safe. But the people of Guam also need to know that we are doing what we can to prepare for recovery. Within the next couple of days, both houses are expected to pass a new stimulus package to address small businesses who have been hit hard by this pandemic. Under the current program, 508 local businesses were approved for loans totaling over 102 million. However, I know more of them need help. This new package may have language to reopen the Paycheck Protection Program and increase funding. Details are still pending, and we will update you as soon as we have them. This would not have been possible without the hard work from our local banking institutions and our resource partners to set up the delivery and compliance infrastructure, ensuring small businesses could get the help they need. In anticipation of this new stimulus package, we ask all of you to be ready. I know that we are tired and that all of us want to go back to life before COVID-19. The quickest way to get there is by acting in ways that continue to stop this virus. Slowly but surely, by taking responsibility to ourselves and doing our duty to each other, we can come through this latest crisis stronger than we've ever before. Now I'll ask Admiral Manoni to make some comments and some updates. Admiral?
Governor, thank you for having me here today. Before I get to our update concerning our efforts collectively to support USS Theodore Roosevelt, I just want to discuss a couple of items. First, I want to send my sincere thanks and appreciation to the local community who gathered to pay the respects and who provided an escort for our fallen service members this past weekend. This solemn gesture was significant and shows the pride and service that our local community and veterans maintain even when our veterans take off the uniform. Thank you. Second, I want to reemphasize that as we continue to test the crew of the Theodore Roosevelt, our team continues to conduct daily health checks for TR sailors in isolation and quarantine. Additionally, we're continuing all PPE and social distancing best practices to ensure that we're doing everything we can to prevent the spread of COVID-19. Concerning the USS Theodore Roosevelt, the Navy announced today that 94% of the TR crew has been tested for COVID-19, with 672 positive cases and more than 3,900 negative results. There are currently 8 TR sailors at Naval Hospital Guam for treatment of COVID-19 symptoms, with 1 sailor in the ICU for increased observation due to shortness of breath. All of these sailors have a good prognosis. The TR team continues to conduct deep cleaning and sanitization of the ship, and we look forward to being able to start moving sailors back aboard in the very near future. Thank you again for your continued support and well wishes as we work to complete the mission, supporting our sailors and getting TR back to sea. Thank you.
Linda, you have any comments? Or you just here for questions?
I'm here to elaborate on our ability for elimination.
Okay.
Do you want me to focus on that? Okay. What we're going to do at Department of Public Health is we're going to work on our ability to expand, as the governor indicated earlier, on our testing criteria at our clinics. And so we're going to now allow testing of all patients with mild illnesses. And that's anyone that presents with fever and one of the following, such as the cough, shortness of breath, or sore throat, and anyone reporting disruption of taste or smell. And anyone who is a healthcare worker, first responder, or cares for a vulnerable population, and again with fever, cough, sore throat, or any alteration in their taste or smell, or have diarrhea. Swabs that are not able to be done on Guam will be sent to DLS for testing off island. The other prong that we're doing is we're going to do active case finding, especially for a lot of our patients or individuals that live in these isolated remote areas. And we'll be working with the mayors to do that, and so that we can identify all these patients in our whole island. The other part that we're going to do in terms of elimination of COVID is to continue to track all our current cases. And also we're going to have a team that would have a permanent task in contact tracing. And so we're also coming up with other innovative technology, such as MIT's Safe Cases and also Emocha. These are electronic devices to help us in tracking and following patients and all the contacts they have with. Thank you.
Okay. So we're open for questions now.
And again, just as a reminder, you will get one question or follow-up. We'll begin with 857. May Habib.
Half a day, everyone. Thank you for
Good day, May.
Hi. This is to the Admiral. I'm just wondering, you said that you are hoping, the deep cleaning and sanitization continues. You're hoping to get the sailors back on the ship and get the ship out to sea. What's a realistic timeline for that? Because we've seen national sources quoted saying this week starting today.
Well, we're not moving sailors back on the ship today. I can confirm that. I'd say in the next couple of weeks, we're looking to have the majority of the crew back on the ship and then working to get them out to sea in the very near future.
Your follow-up question?
Yeah, the follow-up would be with regards to confirming sailors that had initially tested negative and were in quarantine in hotels. Can you confirm that some of those have now tested positive?
Yes, some of those sailors have tested positive. As I stated in my opening remarks and previously, we are doing medical checks on these sailors at least twice a day. Throughout this process, in conjunction with what the governor and I had agreed to, sailors only went into the hotels with a confirmed negative test. And then if they presented with influenza-like flu symptoms, were suspected of a COVID-19 or had a positive test, they were immediately either treated at Naval Hospital and then released back to Naval Base Guam to be put into quarantine, or they remained at Naval Hospital under the care of physicians.
Thank you, May. Next is the point, Nick Delgado.
Hi, Governor. Hi, Linda. Hi, Admiral. So it's great news to hear that we're going to be expanding the testing capabilities. Just to clarify, you said that's going to be for those with mild symptoms, fever, cough, sore throat, and as well as diarrhea and other symptoms that you've noted for the past few months. What brought us to this point? Were we able to get more test kits, and if so, how many more test kits? And were we trying to conserve any of those test kits? And has the local government also received any test kits from the military?
I'll let Linda answer about the test kits. So she's the person that really has immediate information about them.
Yes.
But I just wanted to say, Nick, that over the last week and a half, we've been seeing that our volume of testing, that's people that come to be tested because of the symptoms, it is decreasing, which is, I think, a good sign. The other thing is that since April 7th, I've been tracking this, we've been really very, very low in our trajectory of our infected cases. We were averaging maybe 1 or 2 a day, and in the last few days, we've been seeing 0 positives from those tests that have been done with public health and other entities that report to public health. So as a result of that, we wanted to we then started thinking, and I've been thinking about this over the last week and a half, that we need to start looking at recovery period now. But in order for us to be very comfortable and confident that we can start lifting these restrictions, I wanted to make sure that we really have a good database on how well we have succeeded in prevention, and we also wanted to find out if these cases are really being eliminated. And to do that, we wanted to, of course, implement the strategy of expanded testing. And that expanded testing will give me a better idea of how our community is in terms of community spread and in terms of incidence, prevalence. And so we are going to expand out to populations that we feel may be a higher risk of infection than other populations. And public health is going to be the key stakeholder in making sure that we hit those various places. And then, of course, once we have a full capacity of our test kits and our test machines, we'll expand it more to frontliners and so forth. I am very confident that we can build that capacity of testing. And we know through public health guidelines and through experience with other epidemics and pandemics that testing is a very important tool in order for us to get much more accurate data of what the community is doing. So I am aware that we need to get our capacity to testing. I will also restate my position that I am only allowing test kits that are FDA approved and that have been vetted through FDA, that have been vetted through the standards of US guidelines through CDC, through the American Public Health Laboratories, and other officially recognized sanctioned entities that will assure our public that when tested, that your results are reliable. I'll also now hand this over to Linda, and she can tell you the capacity of our testing.
Yes, thank you, Governor. And as you indicated, yes, in regards to your second part of your question, we are having more shipment with the testing. We were, of course, given a lot of help, and this is coming from 2 sources: the World Health Organization for 200 more gene expert test kits that are expected in 2 weeks, and then 3 additional shipments will follow every 2 weeks. The other source is through the US CDC. We're expecting 200 kits that will be pushed forward. It should arrive on April 22nd, and an additional 200 kits are expected on April 29th. On top of that, we also have been given the Abbott ID now, which is the rapid testing. We're expecting 700 of these test kits to arrive after April 20th. And so having that capability and ability to test more, we are very concerned that the high-risk individuals, especially the uninsured as well, and we're going to focus on those efforts and working with the mayors to do that, those pockets of infections that we can focus on and do close contact. And then, as the governor indicated, we'll move forward with the healthcare workers and the frontline responders, first responders.
So I expect this testing to begin this week.
Yeah, that's wonderful news. Congratulations on getting that done. I mean, that'll be great to see the 0 positive cases, just as we've seen over the weekend, and then see a larger number of testing being performed. So great job to you and the team. My second question has to do with the TR sailors who had tested positive in the Tumon hotels. I don't know if you guys saw Dave Duenas. He wrote a letter to our editor saying, one Guam means one total of COVID-19 cases. And so he questioned, and I've heard this from others time and time again, why don't we include in Guam's numbers those who tested positive on the ship?
Because they aren't really being monitored through our CDC system. The military has their own internal, I guess, nationwide military system for tracking, but they're all, I think, using the same CDC guidelines. And so, they're almost a country in themselves, the military. And so, with ours here, we only track what is being, I guess, originated from Guam. And so we work very closely with the CDC in the mainland in US. And I know the military works with CDC also. So all these numbers go to CDC and they're all compiled as one US number. So when you see those numbers that says, 700 and some thousand are infected and this many are death fatalities, that includes Guam. And I'm pretty sure it also includes the military. So there's one repository of numbers. However, different sources of where those numbers are coming from is what's happening. I don't know if you want to add anything.
No.
Thank you, Dave. PDN on the floor.
Good afternoon, Governor.
Good afternoon.
So on Friday, you indicated to Pacific Daily News that you were aware that several of the sailors who originally tested negative later tested positive. This was an issue, as you know, of large community concern even prior to the sailors actually being moved into the hotels. Can you tell us why the community wasn't informed of this development and how you plan to address that lack of transparency?
It is not a lack of transparency because the military was very aware of it. And I just want to say the community was not endangered in any way. No protocol was breached and no endangerment to the community. That's my greatest, that is my greatest concern. And as I have said in the past, that I wouldn't have allowed the hotels to be used for our sailors if I felt that it's going to expose our community even greater. And when we worked on the guidelines, the infection control policies, the conditions and the assurances from the military that they would have their own military people, they would have their own security people, it's not going to impact our resources at all. In that there might be, as a result, there might be less resources for the community. That's not happening. I don't know all the specifics. The Admiral just tells me today there were 2 people, and I don't know if there were 2, but he does communicate to me on a daily basis, and he does tell me what's going on with the military side. I am confident and assured that it doesn't impact at all our resources and it doesn't at all endanger the
All right, thank you. And for my follow-up, this is for Rear Admiral Manoni. So how many sailors in total that are housed currently in Tumon hotels tested positive after testing negative?
So for TR as a whole, and this includes the sailors that are on Naval Base Guam, we've seen about a 2.5% second test positive after a first test negative. So 2.5% for TR as a whole. That's as of today. We're continuing to test and monitor both in the hotels as well as on Naval Base Guam in conjunction with CDC protocols and the agreements that we've made with the governor and her office.
All right,
Thank you, Anamita. Next is KOAM, Minister Lecanto.
Good afternoon, Governor. Good afternoon, Admiral. Good afternoon, Director DeNorsi. I just wanted to go back to the expanded testing. Governor, earlier you said that it would be very targeted and it would be of high risk infection areas. Could you elaborate on that? And could you tell us if it's going to, if this for surveillance testing or diagnostic, is there a difference?
There is a difference. First of all, the targeted population is really defined by public health, and maybe Linda can speak to that. But we're going out to the villages is what's happening here. We're doing a community outreach in the villages. And she's going to be working with every mayor in the villages to make sure that they have identified with the public health those areas, the mayors know their people, those areas that they feel maybe there's infection exposure there, but they're not sure, and therefore we need to test. So she's going to be working with the mayors in that sense. What was your other one, Nestor? You got me so excited about that one. What was the other question? Or the other comment?
The distinction between surveillance and diagnostic, because I think the diagnostic is what those are the results that we've been getting, right? The 0 positive out of 9. I think what a lot of people are a little concerned about is why are we not testing more, and that's where surveillance testing comes in, I believe.
Well, so it doesn't necessarily is true that if we test more, there's more surveillance. When we want to test more, we want to catch all those people that may be positive, that's not exhibiting symptoms, but they are also just as contagious as those that are exhibiting the symptoms. And so how we can find those people is through diagnosis. And that's where we then use the adequate and appropriate machine and test kits to provide the diagnosis. So diagnosis and monitoring is very, very crucial. Surveillance is more going out there and working with the community in terms of trying to find out what is the immunity out there, and maybe Linda can elaborate on that. And so those kinds of surveillance can be done through other methods of testing.
Yeah, I just want to add and reiterate that we have been testing also in addition to what we're doing at the public health lab. We've gotten, and I've said this over and over, with diagnostic laboratory services. In fact, since the time of April 3rd all the way through April 19th, we've conducted 167 tests. And of that, 5 were positive and 162 are negative. And those were mainly the ones that fell below the priority criteria. Those, as the governor indicated, that were asymptomatic. So we have been testing for those samples, and it's not true that we're not just limiting it just for the priority groups, and we've been doing this. In regards to the population where it's diagnostic for, again, surveillance. Surveillance is really where you have the whole community getting sample sizes and getting a representative that is an extreme sample size that would be representative of the entire population, so that we can get good incidence and prevalence rates on Guam. And for right now, as the governor alluded, the only way we're going to do that is also not only looking at people that are coming to the clinics to get a test done, but also we reaching out to those remote areas, those isolated areas where we have people residing in, like, for example, in the Himlani, Gilbaza, Gilbri, Santa Ana subdivision, all these areas, Gilbaza and also Gilbris, Pagacha, Palanta, all these areas. What we're doing is we're working, I've already spoken to the mayor, the president of the mayor's council, and we're identifying areas where we know that all these individuals can be present and we'll have a good turnout, especially in these isolated areas. And of course, we've identified several locations in the northern, central, and southern regions, and we're already preparing for that. And if you want, I can be more descriptive, like the Santa Ana. There's a basketball court that we're planning to put out a tent and do the swabbing there. A Stumbo gym, there's a drive-through on the back, and also Jigo gym. In the central region, Manila and Tawini, where the homeless population resides, there is a senior citizen center there that we can do the drive-through. Agana Mayor's office, there's also a walk-through for our homeless. And southern areas, like in Agate, we have the Southern Visita, which is also a drive-through, and Jogna, which is a gym that we can also do a drive-through. So these are some of the areas that we've identified, and we're going to work with the mayors, as the governor indicated. We're already doing all the legwork and the logistics in that regards.
And
So
I
Linda,
just
how
want
many,
to say, I just want to say we will open it up as soon as we get these priority places first.
So under this expanded testing, how many more people or how many people a day do you anticipate being able to test?
So based on the data and information and calculations done by the medical advisory group, we are expecting to do about 252 per day.
Thank you, Nestor. Next is Mary on his business journal, Maureen.
Buenas, Governor, Admiral,
Buenas.
Linda. So my first question is for the governor. So I'd like to talk about the checkpoints. Many of the people that are driving through them are not accepting leaflets. Many people that are on the road are finding ways to go around the checkpoints. According to the Guard, they do not think that the Guard members are noting how many people are coming and going. So my question is there a lot of point to this, and when will the checkpoints cease?
First of all, Maureen, I don't refer it to them as checkpoints, because I think when you say checkpoints, you're looking for something, and that's not within my legal authority. So I call it roadblocks, because the purpose of the roadblock is to, again, inform people that through decrease in traffic and through decrease in accessing the roads, and only to access them through for essential business, is one of the measures that is very important to implement in order to decrease exposure, transmission, and contact of the COVID virus. That's the purpose. The purpose is to educate them, remind them, and also to remind them to be very responsible and to just travel the roads and be out there for essential business.
Okay, thank you, ma'am. I have a question for the Admiral. I would like to first say condolences from everybody at the Business Journal and Guam Business Magazine. We were very sorry to hear of the passing of the two young men. And my question, a number of us were surprised to hear that the bombers are leaving Guam. Can you confirm that we will still retain the SAD personnel, and also if there are any other posture changes that you're aware of at this point?
So that's a great question. Thank you for that. To answer the first part of that, I know of no plans to remove THAAD from Guam. As far as any sort of posture changes, Department of Defense is always looking at how it postures forces throughout the world, but specifically in the Indo-PACOM region, based on the evolving nature of threats and challenges. And so while nobody consults me on these posture changes, so to speak, because that's not my role out here, I anticipate that we'll see more over time, but I don't think at any time will we see Guam or the Marianas Islands lose their strategic importance. And so I think the U.S. military is here for a long time to come.
Thank you, Maureen. Next is CNC, Kevin Kerrigan.
Good afternoon, Governor.
Hi, Kevin.
In your Facebook post this morning, you spoke about the recovery planning that is underway and the plan that your advisors are developing. You expect that to be finalized by this Friday. I'm wondering if you could tell us a little bit more about that process. What are the priorities? What can we expect to see from this recovery plan?
Okay, so as I mentioned earlier, that because of what the numbers we are seeing, I think we need to start thinking about our road to recovery. And so as a result of that, I impaneled a group of representatives throughout the community to be on my recovery panel of advisors. And these are representatives from the business community, the medical community, the tourist industry community, and other government agencies. And so what this panel is tasked to do is to come up with a plan of what, how, when, and operationalize it, implement it. And so we are using several frameworks that we've been studying and researching. One is this study that was put out by Gottlieb. And the other one, of course, is the President's Opening America Again guidelines, to give us a framework and to give us some idea and some fallback information on how and when do we trigger the phases. And of course, the biggest indicators and the biggest data that we need to look at comes from more the scientific and medical side, which is their advice and their information on when they think we could be able to lift some restrictions and at what phase we should be in. And then when do we go from phase 1 to phase 2? When do we go from phase 2 to phase 3? And when do we go from phase 3 to phase 4? And so, again, that's going to be driven, Kevin, by hospital capacity. It's going to be driven by infection rates. It's going to be driven by severity of the illness. It's going to be driven by how our community spread is. So at the very beginning, when we do plan this beginnings of our recovery, we will be gradually and slowly lifting restrictions. And these restrictions that are going to be lifted will have been vetted out in terms of how can we still do it and still be able to sustain social distancing, still be able to minimize social contact, so that we're not, we're not continuing with exposures that we don't want to be in. So basically, that's what's going to happen. We do have a draft recovery plan. My advisors are reading it, reviewing it, and we're going to be getting information and feedback from the Economic Recovery Organized Committee that I'm also working with. And these are individuals that will give us guidelines in, like, if I say, okay, we're going to open the restaurants, the restaurant industry will say, yes, Governor, and these are the things that I think we should put in place to continue protecting our people from increased exposure and viral contact. That's basically it.
Thank you, Governor. And as a follow-up, it was less than 2 weeks ago that we heard dire predictions that we were only at the very beginning of the disease trajectory and we wouldn't reach a peak until mid-May or even June. Have we seen a sufficient decline in cases to revise that outlook? What is your physician advisory team saying to you now?
So if you look at what we're tracking is actuals, and what we're tracking is every day also, and what we're tracking is hospital admissions. So if you take these three indicators or these three elements and you plot it out from March 12th to now April 20th, right? That's like almost 8 weeks. So now we actually have historical actual data that we can go back and rely on. These predictions were based on a prediction based on there was no data. Because I asked the same question of Dr. Felix Cabrera, and I remember when he first put out the projections, I said, I'm going to prove you wrong. And he said, you know, he'll be so happy to be wrong about this. But it's just a tool. It's a tool, that's all it is, to use to sort of give you an idea of how prepared you should be, you know? I would rather be prepared than be caught with my pants down and we're not doing what we're supposed to be doing to save and help our community. That's basically my attitude about this whole thing. And so if we're over-prepared and we're overreacting, fine, but we saved lives and we contained the virus and, you know, we protected the health of our community. So although there are changes and adjustments being made to that, it still doesn't look good in terms of numbers, but I like where our actuals are going, and I want to make sure we contain our actual reality picture of COVID virus in Guam.
Thank you, Kevin. I-94,
Hi, Admiral Manoni, can we get the latest update on the emergency medical facility, as well any update with the serology study into the outbreak from the carrier?
Sure. So the expeditionary medical facility that's being put in South Finnegayan will actually, they've started to go vertical on it today. What that means is they've had to do some basic site preparation, and they were, I believe this morning, 95% of that was complete, which basically means laying down gravel and leveling out the site. And then today, the Seabees, in conjunction with Marines from Okinawa, who came in specifically for this task, will be putting up tents. And if you want to kind of picture it in your mind, we're talking about a 13-acre medical hospital made out of interconnected tents and equipment. I forget the second question.
The serology study?
Okay, thank you. The serology study, which was asked to be done on TR sailors by the CDC, started today. It is a voluntary study that's being done within the confines of Naval Base Guam. Sailors are being asked to volunteer to fill out a questionnaire or answer a short questionnaire with medical professionals, and then provide 2 biological samples, which will then be gathered up at the end of this week and flown back to CDC in Atlanta for examination. You know, what we hope to get out of this study is a better understanding of how this virus progresses through a population. And then what we're seeing, if you put that in conjunction with positives and negatives, how our testing predicts what a population will do in terms of infection rates and then symptomatics. So hopefully that answers your question.
Okay, thank you. And for my second question, I'm going to switch gears. So this is more so for Governor and Linda. Can you tell us how many deaths in the last month are suspected to have been linked to COVID-19? We understand that several bodies have tested negative for the coronavirus, but there may have been a clinical diagnosis of COVID to have played a part in the deaths of these individuals. So how many bodies have been tested for COVID, and is there a definitive way to determine if a death was COVID related? And how do we count these cases towards the overall COVID number?
Governor, may I?
Go on.
We've had a case with a cluster that we have identified and linked to one of the deaths with the Iglesia de Cristo Church. So that was one of the areas that we identified the death with the cluster. There are other deaths that may not be related to the cluster, and in that sense, it was just a spread that they either occurred through, of course, they have uncompromised immunity, and also there was a case where we have a dialysis patient, and I believe that that was related because of another household member that contracted it through travel, and then that individual that traveled spread it to the mother, and so that's how the mother got it. It was a travel related. So again, it's classified as a cluster because it didn't originate from the mother, it originated from the daughter that came, and the infection occurred not only with her but also her husband. And so those are how we identify the clusters and how they continue to spread. So we've had several cases already with that. But in regards to the death, there's one that I'm very much aware that is related to that cluster, and then the other one was a household cluster. The other one was a church gathering cluster.
So can I ask what your question is again? Is it how are these bodies related to COVID?
Yes, because they're clinically diagnosed of COVID. Oh, sorry.
Yeah.
But they were also tested and they're positive for COVID.
Yes, so the question is, how do we count these cases towards the overall COVID numbers if they're clinically diagnosed of to be in part, are they in part of the death?
Yeah, so when you do the diagnosis that comes from the clinic, meaning they're tested, that would be a confirmed case. When they're clinically diagnosed, it's classified as a probable case. And so they're separated, but at the end, they're tallied together for the overall grand total. So,
but there has not been a death that is a death that's clinically diagnosed as COVID. All the deaths, all the fatalities has been positive COVID tested.
Testing from the laboratory. Because she asked about clusters, that's why she was trying to connect that. Does that answer your question?
Adriana, does that answer your question?
Well, partially not. I mean, I'm more so concerned on how many people have died that may, even though they weren't, I guess they presented symptoms with COVID.
Okay, so when they're presented with symptoms of COVID at the hospital or even anywhere else, they're considered a person under investigation. They collect the sample, the nasopharyngeal sample, and then they test it. So everyone that's PUI labeled are either not positive for COVID or positive for COVID. So all those that did, became a fatality are all tested as COVID positive. No, we're good. Let's move on.
Thank you, Adriana.
Hello, Governor.
Hi, John.
Right. So this is a question about the stimulus check. Now, back in the stimulus check, Governor.
Oh, okay.
So back in I believe it's early April, you stated that in order to get the rest of the 134 million, we needed to get final approval from the U.S. Treasury on the payment implementation plan, and that would require developing the plan, submitting it to the IRS for review, and then getting that final approval from the U.S. Treasury. After that, it
Right.
would take about 2 weeks, as soon as 2 weeks to get the checks. So where are we in that process? Can you provide a definitive timeline on when we'll get the final approval from the U.S. Treasury?
So when we first heard about this financial opportunity to help our individuals here, um, Daphne got all the requirements and began the process of certifying and registering for it. One of the process is that you have to submit an implementation plan. How are you going to distribute these checks to the individuals, and so forth? So she had submitted it about maybe 2.5 weeks ago. I do know that it's being reviewed by the attorneys of the IRS. And once the attorneys of the IRS have reviewed it and approved it, they will send it to the US Treasury. They will review it and then we will move forward. It's been about maybe 3 weeks already. And at our last meeting with the president and the vice president, I asked the president if he would follow up with the process there, and he said he was going to follow up. So that was last week. So we are going to be communicating with our intergovernmental director, who is uh, special assistance to the president, to see where we're at. We have not yet received any approval. At least I am not informed. I don't know if Daphne has any more current update, but I'm pretty sure that if she got any information, she would have sent it up my way. But as to this date, we have not had our implementation plan approved.
Thank you, Governor. So the second question involves the plan to assist the homeless. So we know that that plan is currently undergoing some fine tuning.
Yes.
Over the weekend, Senator Moreland submitted a letter to you, offering some suggestions as well as asking, I guess, to have some sort of update on the plan. The question is, as far as the expanded testing goes, will homeless individuals also undergo mass testing? And Governor, how do you respond to the criticism that it's simply taking too long to have this plan implemented to assist the homeless?
One, they will be, of course, part of the testing that we are in terms of targeted population. The reason it's taking a while for this is because we had to have people out there to identify the sites, and not only identify the sites, but also come in and make an assessment of the site. And then once we made the assessment of the sites, we actually approved it. And right now they are repairing the necessary bathrooms and showers. And then we're in the process of getting the tents. The tents is the concern because we don't have immediate access to tents here. We may have to buy it from off island. We're trying to work something out with FEMA to see if we can use their tents in the meantime. So really, since March of last part of March, when we started doing this, it's been over maybe 2.5 weeks since a suggestion has been made, evaluations have been made, regulatory requirements have been met, and now we are going to implement it. It started, again, it's being repaired, renovated. The National Guard people tell me it'll be ready in 5 days.
Thank you, John. And now for some closing remarks for Governor.
Thank you very much. The single most important thing you can do to avoid infection is to reduce your face-to-face contact with people. All of us understand the importance of flattening the curve, and we each must do our part to slow the spread of the virus. Over the past month, we have explained the importance of social distancing on our physical health, but it is far too easy to forget the toll these measures can take on our mental well-being. In a time when increased social connections are needed to address feelings of loneliness and stress, we are instead asked to further distance ourselves from each other. COVID-19 response is lonely by nature. Increased social isolation measures can cause heightened anxiety, depression, and stress, and it disproportionately affects the poor, the elderly, and the disabled, populations that are already at a high risk for feelings of isolation. Caring for a community's well being becomes just as important as caring for their physical health. To address these concerns, accessible and free mental health services are especially vital. Crisis hotlines across the nation and Guam have seen a surge in the number of calls. The Guam Behavioral Health and Wellness Center crisis hotline workers continue to support, engage, and connect. And we connect with callers who may just need someone to talk to. This crisis hotline runs 24 hours a day, 7 days a week. Since the start of this pandemic, the crisis hotline workers have received an average of 25 to 30 calls a day. These calls can last as little as 5 minutes to as long as an hour. Despite having their own fears and concerns with COVID-19, our 28 crisis hotline workers are more dedicated than ever to helping our callers. They are helping people with long-term mental health challenges find someone to talk to, someone who has lived these challenges themselves, and do it while staying safe and staying home. If you are feeling stressed or anxious, I want you to know that what you are feeling is completely normal. If you are feeling lonely or disconnected from the world, I want you to know that you are not alone. We will get through this. If you are feeling overwhelmed or anxious, you can access the crisis hotline by calling 311. To our crisis hotline workers, your efforts are not unseen. We thank you for everything you are doing to help get our people through this crisis and for being our COVID heroes. Thank you and Sijus Masi.
Thank you, everybody. We'll see you again tomorrow.